Assalamualaikum warahmatullahi wabarakatuh. So we are the group 2. So my name is Junaid Pintoata. Together with my friends or partner in this topic, Nahid and Abdul Malik, we will be discussing the Prader-Willi syndrome. So what is Prader-Willi syndrome? So it is a rare genetic disorder that results in a number of physical, mental, and behavioral problems. A key feature of Prader-Willi syndrome is a constant sense of hunger that usually begins at about 2 years of age. So ang Prader-Willi syndrome is yung taong may Prader-Willi syndrome is nakakaramdam siya ng gutom. So, which is nagre-result ito ng obesity. So, people with Prader-Willi syndrome want to eat constantly because they never feel full or they have the hyperphagia. And they usually have trouble controlling their weight. And then, many complications of Prader-Willi syndrome are due to obesity. Yun nga yung sinabi natin kanina. So, ito yung picture or sample ng taong may Prader-Willi syndrome. So let's move to the clinical manifestations of Prader-Willi syndrome. So typical symptoms of Prader-Willi syndrome include the following. So first is an excessive appetite and overeating, which can easily lead to dangerous weight gain. So ang tulad nga ng sinabi natin kanina na yung taong may Prader-Willi syndrome is kain lang siya ng kain because nakakaramdam siya ng gutom. And then the next one is the restricted growth. Children are much shorter than average. So yung may Prader-Willi syndrome is yung paglaki niya is hindi normal. Kumbaga na yung height niya is hindi normal compare sa mga normal na bata. And then the next one is floppiness caused by weak muscles or having a severe hypotonia. And then the next one is learning difficulties. So parang yung may Prader-Willi syndrome is parang mahirap siya maka-catch up or maka-learn ng mga bagay-bagay. And then the next one is lack of sexual development. Alam na natin yan. And then the next one is behavioral challenges such as emotional outburst and physical aggression.
So good day and assalamualaikum. So I am Nahid Makabanto Gulgul. So I am assigned to discuss about the causes or etiology of the Prader-Willi syndrome and the complication. So now let's start for the etiology or causes. So Prader-Willi syndrome occurs because of a certain paternal genes that should be expressed are not for one of these reasons. So first, there is a maternal genes on chromosomes that are 15 are missing. So meaning to say, during the paternal of the child, there is a missing genes, which is a chromosomes that are missing, which is 15 chromosomes are missing. So the child, second is the child inherited 2 copies of chromosomes, so 15 from the mother and no chromosomes 15 from the father. So meaning to say, there is the abnormal chromosomes of the child. So there is a causes that the child may come with the Prader-Willi syndromes. So there is some error or defect in paternal genes on the chromosomes of 15. So in Prader-Willi syndromes, a defect on chromosome 15 disrupts the normal function of portion of brain called the hypothalamus, which control the release of the hormones. So in most cases, the Prader-Willi syndrome is caused by a random genetic error and it's not inherited. Determining which genetic defect caused by the Prader-Willi syndrome can be helped in genetic counseling. So now let's move to the complication of the Prader-Willi syndrome. So there is a obesity-related complication. So in addition to having a constant hunger, people with Prader-Willi syndrome have low muscle mass, so they need a fewer than average calories, and they may not to be physically active. This combination of the factors makes them prone to obesity and the medical problems related to obesity. So meaning to say, Prader-Willi syndrome patients will having a problem on the body because of the obesity. So there is a possible na yung Prader-Willi syndrome patients na yung muscles will be mass, and also they are not fully physically active. So there is a type 2 diabetes, high blood pressure, high cholesterol, and heart disease, and then sleep apnea, and other complications such as increased risk of liver disease and gallbladder stones. So there is also a complication of an inadequate of hormone production. So there is a sterility and the osteoporosis. In sterility, there have been a few reports of a woman with Prader-Willi syndrome become pregnant. Most people with this disorder are unable to have a children. So meaning to say, in sterility, there is para naman to sa mga women that they cannot be unable to having a children kasi they have a Prader-Willi syndrome. And osteoporosis caused by yung bones natin is sobrang weak. So that parang yung hindi nabubuo yung bones nila, so that yung bones nila is sobrang hina.
So, good day and assalamualaikum. I am Abdul Malik Marum Salik. Then I will be discussing my part of the topic, which is the diagnostic test, diagnostic testing, medical management, and nursing management. So first is, here are the diagnostic tests that can be done to the patient with Prader-Willi syndrome to diagnose the disease. First is genetic testing. So genetic testing can be used to check the chromosomes in a sample of your child's blood for genetic changes known as to cause Prader-Willi syndrome. So yun na nga, alam na natin na yung Prader-Willi syndrome is a chromosome disorder. So this will help in identifying kung mayroon bang changes doon sa genetic ng client or the child na nagkakaroon ng Prader-Willi syndrome. So as well as confirming the diagnosis, the results should also allow to determine the likelihood of having another child with the syndrome. So this also will help in this genetic testing kay it will also help na dun sa mga parents na who will have a genetic testing para ma-identify nila or ma-confirm nila if there is a possibility na magkaroon sila ng anak na mayroong Prader-Willi syndrome. So the next diagnostic test will be DNA methylation testing. So this is the best initial test, as all persons suspected for having Prader-Willi syndrome should be tested with DNA methylation analysis. This test detects nearly all cases of PWS. It also detects Angelman syndrome, which involves the same region of chromosome 15, which is usually the affected chromosome for Prader-Willi syndrome. Then the next one will be the medical management. So first is, for the medical management, we have physical therapy. Kasi yun nga, yung sa patient natin is pwede siyang magkaroon ng complication which nagkakaroon siya ng low mass which is nagiging physically inactive yung physical ng child or individual na mayroong Prader-Willi syndrome. Next one is orthopedic management kasi yung orthopedic management is doon sa mga bone disorder, which is bone disorder or abnormalities caused by the Prader-Willi syndrome. We have technological aids such as mga invasive testing or imaging tests like MRI, CT scan. This also identify and laboratories which also help in identifying the presence or diagnosing the Prader-Willi syndrome. Next one is we have human growth hormone, which is usually recommended for children with Prader-Willi syndrome. So this is the best therapy for Prader-Willi syndrome, as it will help also important have important health benefits. For example, it increased muscle size as the individual or child that has a Prader-Willi syndrome have a low muscle mass. So moving on to the nursing management, first is the uh, ensure that the therapeutic communication to ease the change of environment. The nurse needs to communicate with the family to learn as much as possible about the child activities at home. So ensure there is a therapeutic communication between the patient and the nurse and a healthcare provider, and also to the family, as this indicates a good flow of communication para ma-relay yung concern ng family at saka yung gustong iparating ng healthcare provider doon sa family para i-aid nila sa child nila na mayroong Prader-Willi syndrome. So next one is enhance self-esteem, assess the patient to increase his or her personal judgment of self-worth. So minsan kasi nagkakaroon kasi ng low self, hindi minsan pero kadalasan is nagkakaroon ng low self-esteem yung individual na mayroong Prader-Willi syndrome. So it is important na magkaroon ng enhance self-esteem kasi this in giving this improving self-esteem will help the healthcare provider and the patient na maging mas effective yung treatment or treatment na ginagawa sa kanya. Then provide emotional support, provide of reassurance, acceptance, and encouragement during the time of stress. So kailangan is iparamdam natin sa patient natin na we are there to provide emotional support for them. It could probably also spiritual support kasi nagkakaroon ng self-doubt or low self-esteem yung patient at nagkakaroon siya ng stress or anxiety attack because of unprecedented or hindi niya matanggap kung ano yung nangyaring changes sa katawan niya. The next one is strength, family support. Utilize the family strength to influence patient health in a positive reaction. So we have to inform the family or SO na kailangan mas i-improve nila yung family support nila kasi yun na nga yung nagkakaroon ng stress yung patient, especially pag walang nag-motivate sa kanya or nag-encourage sa kanya that everything will be okay, or due to the process of therapy is na magkakaroon siya ng improvement. Next one is prevent injury. Prevent physical injury by providing a child with a safe environment. Kasi nagkakaroon yung prevent injury, yun nga yung patient natin na may PWS or Prader-Willi syndrome is not physically active. So it is important na magkaroon or mag-initiate or ma-prevent yung physical injury. Then next one is prevent deformity. Prevent physical deformity by ensuring the correct use of prescribed braces and other devices by performing ROM exercises. Yun nga, mayroon tayong orthopedic management para doon sa para ma-prevent natin yung deformities. Next one is encourage mobility. Mobility by encouraging the child to perform age and condition appropriate motor activities. So this encourage mobility para maging physically active yung patient dahil sa low muscle mass niya is nagiging physically inactive. So we have to promote mobility na which is ugma or tugma doon sa age niya or kaya niyang gawin such as ROM or other exercises na that will provide or encourage mobility. Next one is increase oral fluid intake, promote adequate fluid and natural nutritional intake. So manage sleep and rest period, foster relaxation and general health by providing rest periods. And also enhance self-care, encourage self-care by urging the child to participate in activities of daily living, using utensils and implements that are appropriate for child's age and condition. So, kailangan is magkakaroon tayo ng ma-improve natin or ma-enhance natin yung self-care ng patient natin for their improvement na even if mayroong the presence of Prader-Willi syndrome is mayroon silang limit or magkaroon sila ng limit or self-care sa sarili na kung ano yung mga dapat nilang gawin, para makatulong sila doon sa process of therapy. Next one is facilitate communication, yung tulad kanina therapeutic communication, para maging mas effective yung process or progress ng therapy. Next one is enforce therapeutic measures, assess and multidisciplinary therapeutic measures designed to establish locomotion, communication, and self-help, gain optimal appearance, and the integration of motor function. So there are various or multi-therapy na the patient will undergo when they have a PWS kasi as a child kasi madami silang improvement or may developmental stages sila. So if meron silang low self-esteem because of the presence of Prader-Willi syndrome is nagkakaroon ng gap or nagkakaroon ng delay doon sa developmental stage ng student, ng patient natin or yung child, kaya kaya mayroong multi therapy or multiple therapy na kailangan i-undergo yung child para hindi siya magkaroon ng debridement doon sa development na kailangan niyang ma-develop.